Coming up next, Dr. Desai answers our questions about the flu shot as we dive right into flu season. Well, we are, of course, heading into cold and flu season. So Dr. Desai is joining us live this morning to talk about that flu shot. Good morning, Dr. Desai.
Good morning, Pat.
All right, so let's get right into it. Let's start with the easiest question. Who should get the flu shot?
You know, anyone over 6 months of age, and there's some people that are especially at high risk for getting complications from that. So the younger and older patients. So if you're less than 5 years of age, if you're over 65, if you're immune compromised, if you have any chronic medical conditions that affect the heart, the lung, or the endocrine system, like high blood pressure, asthma, or diabetes, or if you're pregnant, you're especially at high risk from complications, so you should definitely get the shot.
Yeah, and I don't know if you can speak to this, Dr. Desai, but I remember last year sort of a strange thing happened because of the pandemic. Everybody was sort of isolated and wearing the masks, that the flu numbers were way down, as I recall. So are you kind of fearful that, maybe this fall it'll spike back up again because people are sort of letting their guard down a bit and getting more out and about than we were a year ago?
Yeah, everyone has a little bit of fatigue of wearing the masks and washing our hands. And last year at this time, we were washing the food from carryout restaurants, we're washing our mail, we're washing everything. So there were less than 750 cases of flu last year, which is very unusual, a record low, which was great. But hopefully we can be vigilant and prevent, it from rising up this year.
And there's always critics who always say sort of at the end of the cold and flu season, like, well, it wasn't a perfect match. It's not 100% effective. Why would I bother getting it? So what would you say to a real critic like that, Dr. Desai, who doesn't think it's worth it?
Great question, Pat. I'm so glad you asked. Well, even if you get the flu vaccine, and let's just say it's 40 to 60% effective, which it is most years, it can help decrease complications. So if you get the vaccine and then get the flu, you're much less likely to be admitted to the ICU. You're much less likely to die. If you're pregnant, you're 40% less likely to be hospitalized, and your newborn baby will have some protection against the flu for a few months. And if you're a child, one study showed that you might cut your risk of having severe complications of dying by over 50%. So even if you get the flu, it's milder and less severe.
Yeah, and there again, we've all been so concentrated on COVID. I think people forget that people do die from the flu. It's kind of a dark thing to talk about, but it does happen every year, right?
It really does, yeah. Between October of 2019 and April of 2020, the Centers for Disease Control and Prevention estimated there were probably around 20 to 60,000 deaths. And unfortunately, there were 200 to 400 children that died during that time frame as well. So it does kill a lot of people every year.
Real quick, if people wanted some tips on where to get the flu shot, what would you tell them?
I just think of that old Shakira song, whenever, wherever. So if you're at the grocery store, if you're at Sam's Club, if you see flashing lights saying flu shot here, this is a great place and a great time to get it wherever you are. And if you haven't had your COVID vaccine yet, just getting that at the same time, you can do that as well. So that's just any opportunity you get to get the shot, I would take it.
I really didn't predict you quoting Shakira, but I'm glad you did.
You're welcome.
All right, Dr. Desai, it's very good information. Thanks so much for joining us this morning.
Hey, thank you, Pat. Have a great week.
All righty, we'll see you.